Obsessive-compulsive disorder, or most commonly known as OCD, portrays patterns of unwanted, uncontrollable, and reoccurring obsessive thoughts and fears. These then lead to the individual showing compulsive behaviors that repeat over and over again and are a way to relieve the stress caused by the obsessions. Some obsessive themes include fear of contamination, germs, or dirt, aggressive feelings and thoughts towards other people or even to themselves, needing everything to be symmetrical or in an orderly fashion, having thoughts of losing control, aggression, or harming others, and unwanted thoughts that could include sexual or religious subjects. Now knowing what OCD is, let's take a look at Haru, who has this disorder. On his chart, it shows his personal information, what a regular day for him is like, and some of the signs and symptoms that he suffers with. Haru is 19 years old. OCD can occur throughout all age range, and an individual can start to develop OCD before the age of 25, usually during their childhood and adolescent years. According to Verywell Mind, between 0.25% and 4% of children develop OCD. On average, a child can be diagnosed with OCD at the age of 10, some at 5, and in rare cases, 3 years old. By the National Library of Medicine, about 2% of the world's general population suffer with obsessive-compulsive disorder. OCD is a chronic mental illness, chronic meaning a condition or disease that progressively worsens over time if not treated and lasts for a couple of months or even more. Haru has been suffering from OCD since he was 12 years old. When he was younger, his grandfather had always been harsh on him. Being a kid, he liked to play in the mud and venture into the woods behind his home. He would then get dirty and his grandfather would yell at how filthy he was. His grandfather never showed any signs of affection towards Haru, leading to him feeling neglected and resorted to obsessively cleaning everything. For Haru, childhood trauma was the trigger of him developing OCD as he grew older. People are able to pick up the disorder from their family members by watching and learning the obsessive fears and compulsive behaviors. Or like Haru, it could be because a family member has caused a trauma. Other than the environmental factors, things like biology and genetics can also cause OCD. Abnormalities and changes in the brain's functions or natural chemistry like chemical imbalances can cause a person to develop OCD. As for the genetic factor, according to the Mayo Clinic, a person who has family history of relatives having OCD has a more likely chance of developing this disorder. The signs and symptoms of Haru are fear of germs and dirt, extreme stress and anxiety when people are extremely close to him, losing his temper when things are not properly cleaned, shaky hands, excessive hand washing, showering and toothbrushing, cleaning the house, household items, and car obsessively. Other signs and symptoms that can occur to other individuals are repeatedly checking and having doubts about turning off the stove or locking the door even though that they know that they have, extreme stress when things are not facing a certain way or in the order that the person wants, unpleasant sexual images, counting specific patterns, repeating words, needing to constantly ask questions or confess to seek reassurance, tapping or moving in a particular way, and many more. Some of these include therapy, medication, and anxiety management techniques. The most common medication for OCD is known as selective serotonin reuptake inhibitors, or SSRIs. They help improve the symptoms of OCD since they increase the levels of serotonin within the brain. When given the right treatment, an individual can fully recover. Seeking help and getting treatments eventually led to the severity of Haru's symptoms to lessen. Even though at times he still gets anxiety over things that trigger his OCD, the Haru now is doing much better.